Hi, Dr. Russ here. Today our patient's having a low back problem, which started with a deadlift and was being observed by a trainer. So the form was good and the weight was not excessive, but she felt something kind of tweak in the lower back just as soon as she was picking up the weight. Does that sound right? And that was a couple weeks ago, and it's getting better, but it still hurts across the sacrum and up the paraspinals, and then again across the thoracolumbar junction. So that immediately makes me think about some sacral immobility and some thoracolumbar junctional issue. And the fact that the pain is stretching up both sides tell us there's paraspinal muscle involvement as well. She says there's no leg pain. It doesn't hurt more to cough or sneeze or strain, and so it's probably very likely not to be a disc, so we're going to always be careful, but proceed as though the discs are healthy. Can we start by just having you, I'll just hold this together, can you reach forward and reach for the floor so we can get a sense of the movement? Okay, so good symmetry. You can see a little bit of prominence here in the right lumbar paraspinal, and come on back up. And it definitely seems that the right side is a little bit less mobile than the left as she bends forward, and I think that's what's creating a little bit of posteriority on this side. Okay, so if we look at the SI joints, we can see her dimples here and iliac crest height. It's a little higher on the left. The iliac crest a little higher on the left with the PSIS a little higher on the right. So there's a little bit of a pelvic unevenness. Can you hold that forward? With this right pelvis coming anterior superior. And if we look at the sacral base right here, that looks pretty symmetrical, no swelling or edema. So it looks like right SI and then the right lumbar paraspinal. So let's have you lay down and get a sense of what the muscles feel like, okay? So our initial assessment is nothing acutely injured. There's no swelling, there's no overt spasm, there's no bruising. The movement is, if not perfect, at least functional. So I'm not concerned that we're missing some deeper issue. She's talking about tenderness as well out here in the outer glute. So let's feel what that feels like. Yeah, a little bit trigger pointy here, and it's the gluteus medius. So I've got the top of her greater trochanter right there. Is that tender a little bit right there?
Yep.
Yep. Okay. And on the left side, yep, a little bit of a twitch right there. So trigger points in the glutes. So I'm going to come around and we're going to feel for the joint play in this right SI. So I've got her foot and one finger right on the SI joint, lower, upper, and then another at the lumbosacral junction. I'm just going to do a little lift and a little jiggle. Here I can feel what this joint is doing. So the joint play is good and the joint movement is good. So that tells me that what's holding it out of alignment is not a fixation in the joint, but a muscular imbalance. So we're looking at the gluteus maximus, this very common trigger point site at the upper inner corner, just lateral to the PSIS. And let's work. I'm ready to start working here. I think first order of business is to get a better alignment of this SI joint. And it feels like that's going to be primarily through myofascial work. And what might be pulling it, anterior superior, is going to be in the psoas and oblique abdominals. And that kind of tracks with the deadlift. As you're bending forward and flexing your hips, your psoas shortens. And then as you're lifting, it needs to do an eccentric contraction in order to keep your lumbar spine stable, but it's lengthening because your hips are going through extension, and that's stressful on that muscle. So right here is kind of where I'm focused. How's that? Tender? Okay. Too much?
No.
Good. So a couple deep breaths, and we're going to do a little bit of deep tissue work right on the bone. There. I just let go a nice little piece. And as always, anytime we're working with deeper tissue, it's not enough just to release and mobilize. You have to do a little gentle work to get things back into the circulation. Attachment trigger point here of that gluteus medius. Just some gentle compression and decongestion. So you can feel a little bit of a twitch right under my right middle finger, right there. So let's check and make sure that joint play is still good, and it is. It feels better. So I think we're on the right track, and we're going to keep working up. What I want to do here for your paraspinals is use a cup. Is that okay with you? Mm-hmm. Okay. I've just got my silicone cup. I give it a squeeze. I place it, let it go, and we're just going to run it up and down. So this is pulling the fascia away from the body and giving a gentle, general stretch to the superficial fascia. A lot of nerve endings in there. All that adipose tissue is very sensitive, and it's a good way to start just getting things moving before we go in a little deeper. Good. A deep breath. Nice. Okay. Same on the left side here. Okay, let's feel this left SI now. Same way, lower, upper, lumbosacral junction, and that's good joint play. Everything there is moving really well. Give me a couple deep breaths, okay? Good. Feeling for her sacrum to rock back as she breathes in and forward as she breathes out. It's nice and symmetrical, nice easy movement. So let's work a little deeper now through the lumbar spine. I'm going to start on the right side. So here's the spinous processes here. That's her midline. I'm going to get my fingertips just to the side and give it a compression and traction outward. I'm feeling for any areas where there might be a little pocket of swelling, which usually shows up as like a grainy, almost like a bubble wrap feeling in the tissues. That would be a sign of a local tear where the tissue was actually disrupted and is going through a healing process. And I don't feel it, which is good. So I would say it doesn't appear that there was actually an injury, more of just like a tweak, for lack of a better term. Great. I'm going to come and do this side now. So I'm going to press in on this side of the spine, down and pull. And again, feeling tissue texture, mobility, pliability, and just how does it respond to pressure. And so far, so good. As we come into the thoracolumbar junction right here, I want there to be nice, free movement between the rib cage and the lumbar spine. So kind of blocking the movement of her T12 and L1 vertebrae as I pull on her hip. And I want to feel a nice, easy opening and movement through this junction where the rib cage meets the lumbar spine. And I'm going to do both sides here. So here on her left side, you can see the movement right here is actually pretty easy. Can you see that? And here on the right side, it's kind of stuck right here. What's this scar from?
I had a thing removed and it got infected.
It's just a skin surgery?
Yeah.
Okay, so it was not deeper than skin. Okay, so there's the bottom of the rib cage right there, and there's the side of L1. So I think we got a little psoas work to do on this right side. So for that, I'm going to have you laying on your left, okay? So I've got her in her side lying position. I'm feeling for hip extension because the psoas and the iliacus mostly check hip extension, and trying to get a sense of how much mobility and pliability those hip flexors have, right where they cross the hip, because right here is where they really influence the SI joint, and right here is where we're getting a knot. So it's a little twitchy and it's a little ticklish for her, but we're going to get a little mobilization here. And this is, can be harder if the patient is larger than me. But in this case, I can do this pretty easily. I got my finger in front of the quadratus lumborum on the very top of the iliacus muscle. And as I induce hip extension, I'm giving a little stretch to that iliacus. Trying to get a little mobility induced. I'm getting some resistance right there. Getting some mobility induced through this hip flexor to let the hip extend. Is this position uncomfortable for you?
Yep.
Good. Okay. Can you drop your knee a little more into my hand? Thank you. There we go. We're kind of connected to the gluteus medius here with my thumb and the iliacus with my middle finger. And this knot right between them, right here, feels a little bit like an epicenter right there. So this is what I call a little bit of a pinch and lift, where I've got the fascia and we're giving it a stretch and getting it unstuck from the layer of muscle below. Unstuck is not the technical term, it would be dehesion. That's it. Nice. So that was a nice little piece of movement right there. And that's kind of the essence of myofascial release right there, getting that superficial fascia to mobilize in relation to the deep. And now with our hip extension, there's a lot more movement right here and a little bit more stuck in the quad. And we'll revisit that soon. But for now, let's come back up to the thoracolumbar junction. So I'm working on the bottom end of the rib cage here, the lateral side of the lumbar spine here. Her lumbar spine is pretty small vertebrae. I can feel the L2 spinous process right here, and it's pretty stuck, it's pretty firm. So the question is, how do we start to induce some movement in here? Let's start by getting the rib moving in relation to the lumbar spine, and the way we do that is with a deep breath. Yeah, so you can see her rib cage expanding up to the ceiling, and then as you breathe out, that just kind of falls back toward the table. And let's do a few more like that, and we're going to get a little bit of movement right in here. I'm following that 12th rib up into this corner, and as she is breathing and expanding her ribs, I'm giving a little bit of a downward stretch, downward toward the sacrum, and getting a little mobility through there, which that was good. Give me another nice deep breath here. Good. And let it out. So now I want to see about getting movement right here, T12, L1, L2. So let's straighten your bottom knee, and we're going to kind of just hook that top foot here. Good. I'm going to take your bottom arm. I'm going to bring it forward a little bit. Can you grab my elbow? Good. So I want you to feel nice and secure on the table, okay? So we're looking at trying to induce a little movement here. Rotation is a nice way to do it, especially rotation with extension. So with my right hand, I'm giving a posterior shear on her pelvis, and with my left finger, I'm holding L1 and L2 stable. So we can start to get a little rotational movement through there. and feeling that resistance. Really pretty deep. So I can go direct, and I can move the vertebrae with the pelvis and induce the correct movement. And I can go indirect, where I am moving the pelvis and the vertebrae in opposite directions and getting a little more of a stretch. And that's kind of feeling a little more effective right here. So I'm going to do 3 or 4 more like that. Let's do some deep breathing with this. So bring the arm up, way up over your head, and stretch this side with a big breath into your side, and then let it on out. Good. Well done. One more time. And let that arm relax. And again, a superficial release, pulling right there, mobilizing that fascia superficially in relation to the deep. So the movement there is better. Can I have this arm? Okay, I'm going to slide like this. I want you to keep a gentle hold on that elbow. And now with my 2 hands, I can induce good, very local rotation right in this upper lumbar section, in a nice deep breath. And let it out. I'm going to go back with the shoulder and forward with the hip. We're going to get a nice rotational stretch in there. That feel okay? One more time. Good. So as I was feeling before, once we had released some tension from the iliacus and the psoas, there seemed to be some tension coming up in the quadriceps. So I'm going to do a brief check-in here. This may be something for another session. Got her vastus medialis here. Feels good. Using my thumbs to check the vastus lateralis. It's nice. The tone is good. There's a little bit of tenderness there. Are you a runner? Ish sometimes?
Ish,
yep.
ish.
Okay. So maybe a little, but right here you can see the taut band of the rectus femoris right there, snapping under my fingers. So let's do some cupping. Gently now, not too much suction, just really gently. Let's get the fascia moving first. Blood flow through, a little neurological stimulation. It's pretty gentle, yeah? Good. But this works really well to decongest tissue, especially the superficial tissue. And there's our taut band in the rectus femoris right there. So yeah, this is not something that we're gonna fix in one session. I would say if you've got a foam roller at home, gentle, right there. So we were talking a little bit before we started the video, and there's some lower leg injuries in the history that might be at play here, and I think that might be a little bit of why this rectus femoris has been overworking. I'm going to bring that treatment all the way over the patella to the tibial tuberosity where all those quadriceps insert, and make sure we're not forgetting any slips. So from here I would say gentle stretching of your lumbar spine, like cat-cow, child's pose, looking for elongation. Hip and psoas stretching, and I can send you some video on how to do that. And some foam rolling here will take some pressure off of your sacrum and give you a little more mobility through your lumbar spine, so it should continue to get better. And you can check back in next week and we can do some more. Okay?